Dr. Julian Tang joins us now from the UK. He's a consultant virologist at Leicester Royal Infirmary and an honorary associate professor in the Department of Respiratory Sciences at the University of Leicester. Julian, we heard one expert basically saying that this is a greatest hits package of everything you would not like to see in a cluster of mutations. Just what are the concerns here, would you say?
Hi, so what they're talking about is the SG mutations that we've seen in previous variants, alpha, beta, gamma, delta, really all combined into one variant, this new Omicron. Those include variants at positions, mutations at positions 417, 484, 501, 478, that we've seen already, and those are the variants. So if you think about an additive effect, if you have all these mutations in the S gene that we know confirm enhanced transmissibility as well as enhanced vaccine escape, you're looking at a potential monster variant that may evade vaccines and increase transmissibility. And that's the main concern.
Yeah, monster, as you say, but there's still a lot of questions that need to be answered. It seems that it's producing more hospitalizations, but it's still early. Deaths are always a lagging indicator. Right now, I suspect scientists in labs running every sort of test you can imagine. When will we really see whether or not these variants have the chance of eluding vaccines, do you think? Is that a few weeks out? I mean, how dangerous could it possibly be?
Yeah, so we've seen with different combinations of mutations, you don't always get massive vaccine escape. For example, if you look at the beta variant from earlier, the South African variant from last year, compared to the Brazilian variant from last year, the gamma variant, they have very similar mutations at those positions. But in fact, the Brazilian variant, the gamma, actually wasn't that bad at escaping vaccine protection. Not as bad as, say, the beta variant, which was actually very good at evading vaccine protection. So the combination is also very important. So we have to wait and see. And those lab studies will take several weeks, if not a couple of months, because they have to produce those mutations in pseudoviruses. And 32 mutations takes a while to induce in these pseudoviruses that they use in the labs nowadays.
The U.S. president urging adults to get booster shots, but isn't this another example of just how we should be racing to vaccinate the world? Because as long as there are large pockets of the world with little or no vaccinations, we're likely to see more and more variants cropping up. I mean, getting boosters in the United States is probably helpful, but shouldn't the focus be more widespread?
Yeah, so that's been the argument all along, and I think that's an important aspect of the global vaccination program. We think that this Omicron variant arose in perhaps a single patient who was immunosuppressed, perhaps like an HIV patient from the Southern African region. And we've seen this actually even reported from the US in some of the immunosuppressed patients where you have multiple mutations arising over time. There's one study that showed that some of these mutations arose in a patient who was immunosuppressed over 150 days. So that kind of single patient origin of these viruses is also not unusual, and that might be reduced with a more global approach to vaccination.
Got about 20 seconds. Are these travel bans going to be effective?
They'll slow the importation of these viruses, but I suspect that a lot of these viruses already, the Omicron's already disseminated across the world in different countries as usual.
So if we don't see it here in the United States yet, that doesn't mean we won't soon, right?
Well, of course, you're not sequencing every positive sample that you have in the US, and you're not sampling everyone who actually may be infected in the US either, just like other countries. So I think give it time, and you'll probably find some cases soon.
Julian, thanks so much. Really appreciate it.
Thank you.